Welcome to this section looking into return to running, a really important element and component from the part of the runner because at the end of the day, the runners don't care about improvement in strength, mobility, and other deficits. For them, it's able to get back into unrestricted training. So every runner that you see in clinic will have one thing in common: they want to get back to running as soon as possible, and to enjoy all the benefits they get, physical and mental benefits. And they want to push back, improve the times, making the progress. So I think we have to have a system in place. For me, the moment the runner comes in the clinic, day one, is when I start planning on the return to running. So for me and for the runner, the most important element is the only success which defines with runners is able to get back running without major pain or hindrance and able to train at the level they want. So that's the only marker which many runners will be able to look at. So let's go and explore a few of those concepts here. So the aim is to understand the factors and rationally and the clinical reasoning process, because this is specifically on runners after injury. In certain cases, we have to stop running, and I'll be very clear on when I would think of that, and that too for a short period, and when to start safely and quickly with the safe process. So I'll be sharing the 3-step process I use in return to running, and also we'll be talking into return to running in specific injuries and cases. And finally, one of the common things people ask when they return to running is warm up and how to prevent cramps. So I'll be addressing those elements as well. And when we talk about injuries, we can't just put them all in one group. Running related injuries is a heterogeneous group. It's based on age, varied experience, injury history, and fitness level. So those things are highly different. So therefore, we need to have an individualized approach. Even with the same injuries, you might have a very different approach with a different type of runners, because for me, the experience and the injury history and the fitness levels are massively important. So we have to tailor it rather than saying, okay, every ITB gets back in 6 weeks or every Achilles tendon gets back in 3 months. That's not in reality happens, because you could have somebody with the same problem, but their return to running will be very different because everybody's starting point will be different, and also their experience. So I think we need to keep that flexible. And one thing which we see again and again in the literature is previous injuries. So we know that this Desai looked into history of looked into 224 recreational runners with 1-year prospective cohort study, well designed study, and what they found out was the common injuries in this was not surprising: knee and Achilles. And recreational runners with a previous injury were twice as likely to sustain a running related injury. So, and I think these are for me, it makes me to think what are the possible reasons. One could be incomplete rehab. They rush back too soon. Number two, they're not addressed address any deficits which could have predisposed to them ongoing weakness, strength, or an early return to running or unrealistic program. They rush back too soon. So I think we need to not to do the mistake and then they go back quickly and then they come back with another new injury. So getting them back to running is not the main idea, but getting them back running without major injury and without recurrence is the key idea. So, and I think a lot of runners think end of pain is the end of pathology. So, in professional sports, once they have done your rehab, they have been seen by the strength and conditioning coach. They sort of go through the journey, and that is something which we want to inform the runners that it's a gradual process to be able to go back to running without rushing, and also appropriate strength and conditioning. So the first 3 months is the highest risk. So when you come back after long injury, the first 3 months you want to not the best time for personal best. The idea is to build up volume and variety, is to gradually build up the time. So the longer you had a break from injury is important. Getting somebody back to the radials pain free is different than getting them back to high level performance. That's two different things. So you still have the healing process going on. Loading means both weight as well as speed based training. So, and once they get fatigued, then movement patterns becomes a problem. So I think we need to really address all those factors. So let's start, when would you stop running? So this is quite an important, and this is a bit of a funny story here, but it's real. So a Colorado man here was attacked by a mountain lion while running, and he escaped with serious but non-threatening injuries after he managed to kill the animal. So this is what happens to somebody who tries to stop a runner from stopping running. So the mountain lion bit the man's face and wrist, but he was able to fight back and kill it in self-defense, that he suffocated the animal. That's quite scary, really. So it just tells you he was able to get out of the park and drive himself, and he expected to make a full recovery. So this is quite amusing, but it just gives you important fact is that is a common theme. Runners are very averse to stop running. So this is sort of is really an important concept, and we need to really be careful when to stop running. And even if you tell them to stop running, many will continue. And this is from Wegeland in 2019. Looked into sort of runners about average age 38, 209 males, 89 females, and what they found out was 33 ran against medical advice. So, and 40 will run with injury. So it's quite a common thing in runners. A lot of runners, even if you say to stop because you're concerned it'll get worse, that will be a problem. And that we need to, rather than dismissing them and thinking it's just foolish, we need to understand why people run. Running is just not about losing weight and being fit. Most people will start running for gaining fitness and general good wealth. Then they start improving their personal best and speed. And the third is they run for meaning. So this is really important. And that you can, nice book here which goes from written by Ian Mortimer, which goes through you might run for fitness, but running is more than the physical act. It's about addressing the challenge. So whenever we ask somebody to stop running, we need to really ask ourselves, what is the physical impact on the body? Are they going to lose fitness, body weight? What's the mental health impact? The mood and stress, loss of community and loss of identity. So those four things we need to really ask. So I think we need to make sure that we only stop running until we feel that that is the only option left and that's in the best interest. So there are about 3-4 categories where I might stop running. First is suspected stress fracture. So if I suspect things like somebody with a previous history of fractures, somebody with a BMI less than 19, a white female, resting and night pain, then I might give them 2 weeks off, or maybe arrange investigation or escalate them. So I think those category, I think you're very well within your reason to stop running till you ruled out a stress fracture. Second thing is acute medial tibial stress syndrome. If somebody comes with acute medial tibial stress syndrome, they're limping, they're struggling to walk for more than 10 minutes. So in those cases, I can't really see the benefit of continuing running. If they're struggling with walking, how can that get better with running? So, and we know that MTSS and stress fractures can be a continuum. If not managed well, some of them can progress to fractures, and that means a long period off from running. Third is joint effusion, active inflammation, and night pain. So if somebody went for a run and they're getting massive swelling in the knee, hip, in the knee, ankle, or a subtalar joint, or a big toe, or where we're getting active synovitis, joint effusion, redness, there might be something else going on. So that needs investigation. So you shouldn't really see joint effusion in knees or ankles. Obviously, you can't see in hips because it's quite deep, but normally they're limp. So when you have an active joint pathology, it could be underlying degenerative condition, could be some rheumatological condition. So we need to address that. So joint effusion is not normal after running. Tendinopathy in the react stage. We're not talking about chronic tendons. Chronic tendons, you can work with it. When they're having an acute flare up, they're struggling, the pain is 8 out of 10, they're limping, then you might want to consider for a short period. One of the things we see is we don't want to lose fitness. We lose cardiovascular, it starts dropping down within 2 weeks. So we need to get them back on a cross trainer, bike, and other activities to keep their fitness levels both for physical and mental health as well. And what we know from the studies is when runners can't run, they stop everything together. So they just it's affecting their mood. They feel like they don't want to do anything. So this study looked at nearly 49 recreational runners. And what they found out was they participated in a year-long observational study. When they were injured, their physical activity dropped massively. There's a significant drop between, and this was not just purely linked with pain. So it seems very experienced runners, when they can't run, they engage in more sedentary activity after suffering an injury. And injured runners do not replace lost running with other forms of physical activity. So pain by itself is not associated. So I think we need to encourage. So obviously runners will be upset because they can't run. That doesn't mean that you stop everything. Obviously do the rehab exercises, but you need to also be involved in engaging in other forms of cardio like stepper, swimming, and other forms of cross training to both perform physical and mental effect. So that's something we need to encourage them. And then when they can get back to running, number one, they're in better shape, and number two, it'll be easier for them because they have kept their fitness level. We don't lose fitness level. So sometimes if they can't run for example 2 to 4 weeks, then you don't want to get them back at a very low level of fitness. So what are the options here? So if you look at studies comparing different types of cardio from treadmill, running to elliptical trainer and a stepper. So this study looked this released very recent study from Bosch from 2021 looking at the physiological response. So this study compared the physiological response to submaximal running with exercise on the elliptical trainer and stepper. So they had 18 trained runners, age around 23, and they did submaximal testing at 60 to 70 and 80% of their peak workload. And they looked at oxygen consumption, heart rate, fuel utilization. And what they found out was the maximal oxygen consumption was not different between treadmill, elliptical, and stepper. So treadmill was around 49.3, trainer was 48, and stepper was 46. So these are therefore the elliptical trainer and stepper are suitable substitutes for runners when they can't be running or because of injury or because of other problems. So these are good modalities because the fitness levels can be maintained pretty much similar. Obviously, the muscle patterns will be different, but you're still getting all the benefits of cardio from a cardiovascular point of view. And when you do go back, then it'll be easier. So I think we need to really encourage that and stop this, where they just sit and sulk and do nothing, and then they become more unfit. We need to get them really into more higher level of fitness, so that when they get back running, then they're in a better shape. So once you're given a period of break because of, for example, a stress fracture or very bad flare-up or things like that, we need to start planning. So this planning phase is really important because that will give us an idea of when do you think that realistically this is going to happen. So there are a couple of factors to remember here. First is type of injury. So that's quite obvious. All injuries are not the same. Ligament injury is not the same as tendon. Tendon injury is not the same as a joint strain and things like that. So the type of injury. So, and I'll go through the next slide, how long it takes, and is it acute onset or a chronic or a recurrent? So is it something which they had it before and it's coming back, or it's just like an acute, like a hamstring or a calf injury? And tissue, what type of is it? Is it a muscle, ligament, tendon, or joint? And history of injuries, how many injuries have they had in the last 12 months? If somebody comes to you and they had 3 injuries, and then somebody who doesn't have any one injury, obviously the one with less injury will get back quicker. So your previous injury also has an effect on your return. The second factor is the profile. What type of runner are we talking about here? How old is he? Is he like 50, 55, or is he 25? So it's going to be different here. The younger you are, you can bounce back. Your tissue quality is better. Your hormone levels are better. So it's a bit more easier. Experience. Are you somebody who's done multiple marathons, who are used to that pain levels and really used to that high level fitness? Or are you somebody who just does 10Ks and 5Ks? How is your general fitness? How is your general health? Do you have diabetes? Other medical conditions? So that will be a factor as well. So the type of runner will also influence this. And the third and another key factor is period of detraining. How long have they not run? Are they still running? Are they only stopped running for 2 weeks? Have they stopped running for 4 months? So that will be difficult. So if somebody is not running for 3-4 months, then you have to plan it very carefully. Then somebody would stop running for just 1 or 2 weeks. So this for me are the 3 most important factors to consider: the type of injury, the profile of the type of runner, and how long they've stopped running. And when you talk about injuries, every injury is different. So this is sort of a generalized, a rough idea of what to tell patients is muscle injuries. Grade 1, we're talking about 2 to 8 weeks. Less than 6 weeks, most of them are fine. Ligament injuries, when you have like ACL and things like that, it can take even 1 to 2 years. Tendon injuries, chronic, we're talking about 3 to 9 months. Things like proximal hamstring can take up to 9 months or more. Fractures anywhere from 6 to 12 weeks. Cartilage 2 years. Meniscus from 3 months. And hip labral pathology is 12 months. And tissues will continue on remodeling for at least 1 to 2 years. And this is just not for everyone. It won't be the same. Obviously, your age, your fitness level, your metabolic factors, nutrition, and if you're a smoker, diabetic, taking oral steroids, that will be less as well. So I think this gives you an idea that the tissue healing time is so varied. You can't compare one injury from another, and this has been shown in another study from Mulvad in 2018, where they looked into average time it takes to recover. They looked at diagnosis and time to recover among injured recreational runner in the Run Clever trial. They looked at 140 runners who had injured for at least once, leading to a 24-week cumulative period. And you can see there's a huge variation. So, for example, like MTS's medial tibial syndrome was massive. So that's quite common with bone stress injury. That can be as high as 70 days. Some injuries, ITB, can be quicker. So we have to remember this is different. So all injuries are not the same. And we have to explain to the patient. If somebody comes to me with proximal hamstring tendinopathy, I say to them that it can be as long as 4 to 9 months. So whereas an ITB, it might be quicker, 4 to 6 weeks. And high risk, when we look into people getting back, there's a certain high risk group as well. So what I mean by the high risk group is novice runners. They're definitely high risk. Patient who had multiple injuries or failed multiple return to running. Type of injury, bone stress injuries generally take longer, and certain tendons. General fitness of the runner, massively important. If you're not fit, either low BMI or very high BMI, low strength, medical issues. And fifth is the exercise addiction, where they use exercise as a form of extreme method to manage their mental health. So those groups, we need to really be careful rather than rushing them. So once we have seen all these factors, and we need to return, so those 3 key factors is type of injury, type of runner, and period of detraining. We need to go straight into the steps. So I kept